Magnolia State Family Medicine, Health Center and Medical Spa, 1009B City Avenue North, Ripley, 587-8176. Call for your appointment. Providing modern medicine with Southern hospitality. That's Magnolia State Family Medicine, 100% veteran-owned and operated. Bethel University Physician Assistant Program affiliated. Magnolia State Family Medicine. Dr. Christopher J. M. Cummins, Medical Doctor. Fast, hot, and fresh. Open 24 hours just for you. Dodge's Store. Come be our guest. Dodge's Store, Ripley. We are 100% employee owned with friendly service and a fun atmosphere. High quality, low prices. We are Food Giant. Our deli serving breakfast, lunch, supper. Food Giant, 702 Highway 15 North, Ripley. Come shop Food Giant. Want fresh meat and fresh produce? Food Giant's the place. High quality, low prices. Food Giant. A proud sponsor of TV19 News and Sports. Cardinal Drive-In, 1807 City Avenue North, Ripley. Cardinal Drive-In, 837-2970.
Good evening, Lee Allen Pegram, along with Dr. Christopher Cummins on the Ask Dr. Cummins Show. Hello, Doc.
Hey, man, how you doing today?
Fine. Well, this weather's not lightening up at all, is it?
No.
I don't think it's ever
We need a little sunshine. Be nice.
Well, it got up to 50 today, and that is a change. At least it's not. Of course, there's another Arctic spell coming in, so
that's what I
let's hop right into it. I've got about 10 questions that we can go over, and some of them, of course, no question is too silly, but this first one I don't really understand. I'll ask it just exactly as she put it to me. Right. It says a lady puts nail polish on a runner in her hose, okay?
Okay.
She pulls it loose when she's taking her hose off, and it leaves a sore. What do? Put some kind of ointment on it, or worry about it, or what?
Likely that's that old allergic contact dermatitis. She's allergic to whatever that polish was that's touching her skin. And best thing to do is just don't do it, or try a different kind of polish and see if it still affects the skin the same way. But odds are, I mean, it's just going to be what we call a local or a reaction that doesn't go anywhere or anything. Should not be a big problem, and just removing whatever the what we would call in medicine the insulting agent, whatever's causing the problem, move it. She should be okay. But she could also get some topical over-the-counter Benadryl cream or something like that. That should make it go away a little faster.
Benadryl is really helps, doesn't it? That's a wonder.
Has the Benadryl like to take by mouth and have something to rub on at home all the time.
I mean, it's good for wash. It's good for anything. Just about.
Put your little baby to sleep too, off label.
Yeah, there's just numerous sources for Benadryl.
Yeah, it's a good medicine.
It is a good deal. Next question, very simply put, is what is a polyp? But that's not a very simple. That's not a very simple question.
Polyp? No, it's
polyps are mainly in the colon.
In the colon. That's where we usually refer to it. A polyp, basically, it's a Greek word that refers to an appendage or something hanging off of something else. Okay, and they can look different ways. There's sessile or flat polyps, or pedunculated when it's like hanging by like a little string or something like that. But polyps, the reason we worry about them and you hear about them, we talk about the colon, is it a cancerous polyp or not? Because that is how you can catch and predict what type of cancer somebody has if they have it real early. Most polyps are benign. Most of them are not cancer. But that's what the stomach doctor is going to do when you turn 50 years old and you get that first colonoscopy. They're looking for polyps.
So they do get rid of them.
They usually clip them off, and it's almost like a little alligator clip or something that pulls that dude off, and they biopsy it. But they usually take the whole thing off, and then they'll send it to the pathologist, who is the doctor that looks at slides and looks at that tissue to see if it suggests that it's cancer or not.
So when you have when you have a polyp, you're not necessarily talking major surgery.
No, most of them been doing it while you're asleep. You don't even know about it.
Okay.
You know, that's just where they're getting that biopsy when they do that colonoscopy. And there are times where there's, polyps also in the upper gastrointestinal tract, the esophagus or stomach. And that's when they do what we call an upper, and this is a hard word to say, we call it EGD, but it's an esophagogastroduodenoscopy. So that's why we say
yada.
That's why we say EGD. It's a lot easier, or upper colon type procedure.
You got to have a Webster's dictionary to go along with what you have to
tell
study, don't you? And then you got to spell it.
You need a translator, I tell you.
Double hard. You not only do you have to say it, pronounce it right, you got to spell it.
And just a little funny thing on that is that you have, north of the Mason-Dixon line, they take the Latin words and they say them one way incorrectly. And then south of the Mason-Dixon line, we take the Latin words and say them incorrectly in a different way.
We slur it, I'm sure.
Everybody's got different ways, and none of them really saying it right.
And they can tell where you're from by how you pronounce the words.
Just by how you say your medical words.
Yeah, well, that's not surprising. Now, they can do that on the English language, too. I can sit there and call somebody in New York, well, I know where you're from.
Or when you get Frank in India,
yeah,
it's not Frank.
Yeah, right. Frank Haji. Walking barefoot, it feels like the side of his feet are curled up. But now he can put on shoes and everything feels fine. He's got a sensation of the sides of his feet curling up when he's barefooted. Is there something wrong there, you think? Or it's not painful?
It's kind of it's a unique description of that. Peripheral neuropathy, or like when you have nerve damage to your feet, that can is somewhat described that way, particularly if somebody's diabetic or something like that. However, other things that can cause that is like vitamin B12 or folate deficiencies. People can have funny feelings and sensations like in their feet and stuff. Another low likelihood, I'm not suggesting this person has it, but sometimes when people have strange feelings in their feet, the fancy medical word is called a dysesthesia or a paresthesia if you can't feel anything. And different types of disease, syphilis is one. That somebody has a late stage of syphilis, they start having those kind of things. But I'm not suggesting that person has it.
Right.
There are obviously a number of causes, but vitamin deficiencies, diseases, and just damage to the nerves can cause it.
Syphilis used to be the most popular or most common disease of sexual disease.
Yeah, that's like one of the first original gifts that kept on giving.
Yeah, Al Capone, that's what he died with.
That's right.
Anyway, that's not as prevalent today.
No.
Penicillin cured that, didn't it?
It did. It certainly, if we can catch it. There are some high rates in Mississippi still in
Still
certain
have
parts. You can go up and down the Delta.
Huh.
If you could go for the for Mississippi's disease thing on the state website, and you can see which states have the higher percentage or which counties. And there are a few places still where it's kind of endemic. But if we could just get them treated, it would not be a problem.
Well, that can be cured. AIDS
Yeah.
is another sexually transmitted disease that more than likely can't be cured if you get it, right?
Yeah, I mean, pretty much you can just treat the symptoms, and you treat the other diseases that AIDS causes because you have that immune deficiency. So when you get one type of bacterial infection because you've got AIDS, we can treat that because we know what that is. But stopping AIDS is another whole thing.
Well, that's I
The
didn't mean to get into that.
But the big thing about a lot of those venereal diseases, sexually transmitted diseases, is you got to treat the partner too in most cases.
Well, yeah,
And
you
then-
want to know you want to know who the partner is,
Right.
And you should be able, with great ease, the person really doing themselves and everybody else in the county or wherever the area, a big favor by telling who the partner
Absolutely.
is.
Or just we can get that medicine to them. It's important.
Man, that's some bad stuff.
It is.
What's the killer?
Literally.
All right, next question. What about the healing power of honey? It says they also use bleach on insect bites. And is that okay to use bleach? Is it okay, or does honey have any healing power? That's an old wives' tale that they came up with.
Right. Honey From a alternative medicine standpoint, probably does have some benefit, and they're not completely sure what all it does, but it is said to boost the immune system. Taking that internally, rubbing it on or something like that is probably no benefit. As far as putting bleach on the skin is not recommended.
On anything.
On anything.
She was talking about insect bites, like a wasp sting,
Yeah, I know.
mosquito.
Used to when I was a kid, if you got into a bunch of chiggers, first thing your mama did is put you in the bathtub and pour a bunch of bleach in there with it.
Well, we had, and another thing was camphor-phenique. I was in Walmart the other night and I saw camphor-phenique. You remember camphor-phenique? You may be too young for that.
I do. I remember my mama used to just get Vicks salve and rubbing it all over my chest like crazy.
Yeah.
But anyway, the bleach probably does more harm than good. It's going to dry the skin out. It's an irritant, and it's probably not real good to be breathing a lot of that stuff. But there are certainly some other ways to treat those bug bites. Usually like that Benadryl cream like we referred to, that's probably going to do a lot. Now, if your skin gets infected, then you're talking about antibiotic of some sort. But generally, just an allergic local reaction from a bug bite, that Benadryl cream over the counter is probably going to help.
There we go back to Benadryl.
There you go.
Benadryl, better get some of that stuff. Ointment and peel, that's good stuff. Another quick one before we go to our break. There is something called speech nodules. What are speech nodules? Are they catchy? And how do you get rid of them? Do you understand what I'm talking about? Speech nodules. Nodules. Speech nodules. I've never heard of it.
That's kind of a new term on me. The only thing I can relate that to is, the voice box can get nodules on it, the vocal cords themselves.
Yeah, I've heard of that.
And that can be from scarring, from having an infection, or a viral infection, bacterial or viral. And that can certainly happen. Other things that can do that is from smoking or from other type of disease processes, you get some scarring on the vocal cords. But nodules would be a concern. It's almost like a polyp.
That's what I was fixing to say. It'd be in the polyp range, yeah.
And I know I had a patient who had a chronic cough, and we looked at all of the medicines he was on to make sure nothing was causing that from the medicine. We treated it, like you would a common cough or a virus or a bacteria over a course of several months, and it kept on going. I said, well, it's time to get him to an ear, nose, and throat doctor after we have done what primary care doctors do, because they have some tools sometimes to go back deeper in the mouth and look. And sure enough, he did have polyp or a nodule at the back of his throat, and it was cancerous.
Ooh,
that's very rare, but he did, and now he's been treated. He's doing okay, thank God. But
I saw a movie back in believe it or not, that hit a note with me, and it was just mental telepathy because it was a 1939 movie that came out with Cary Grant and somebody, one of those people back in 1939, and the girl got what they call speech nodules, and it cost her voice. So they had to get somebody else, and Cary Grant. I mean, it was a movie, but speech nodules was mentioned.
Wow.
As far as affecting a singer being able to project her voice. So I guess it's kind of like polyps.
Same fashion, nodules and polyps are very close in that description of what they are.
Right. Okay, folks, we're going to take a little break. We'll be right back after we hear from our sponsors.
Magnolia State Family Medicine, Health Center and Medical Spa, 1009B City Avenue North, Ripley, 587-8176. Call for your appointment. Providing modern medicine with Southern hospitality. That's Magnolia State Family Medicine, 100% veteran-owned and operated. Bethel University Physician Assistant Program affiliated. Magnolia State Family Medicine. Dr. Christopher J.M. Cummins, Medical Doctor. Fast, hot, and fresh. Open 24 hours just for you. Dodge's Store. Come be our guest. Dodge's Store, Ripley. We are 100% employee-owned with friendly service and a fun atmosphere. High quality, low prices. We are Food Giant. Our deli serving breakfast, lunch, supper. Food Giant, 702 Highway 15 North, Ripley. Come shop Food Giant. Want fresh meat and fresh produce? Food Giant's the place. High quality, low prices, Food Giant. A proud sponsor of TV19 News and Sports. Cardinal Drive-In, 1807 City Avenue North, Ripley. Cardinal Drive-In, 837-2970.
Well, we certainly are glad you've joined us tonight. The number for your questions is 587-8176. Please give that number a call and ask your questions, and we'll get you an answer. We also would like to say, if you go into one of our sponsors, would you please tell them you saw their ad on TV19? We sure would appreciate it. Doc, are you a football fan?
Not as much as I used to be, but I still keep up a little bit.
I'm going to change the subject real quick. Did you watch the ball games yesterday?
I did not.
Well, old Jay Cutler for the Chicago Bears, he hurt his knee, and they said he tanked on him and chickened out in the second half, and I think he was really hurt with his MCL. Packers won and the Steelers won, so it's going to be the Packers and the Steelers in the Super Bowl, so that's not a surprise.
I was doing Army stuff this weekend.
You were playing Army this
National
weekend.
Guard over in Tupelo.
Well, that's more important than watching football, man.
I think they were talking about it, though.
Well, yeah, it created an interest, I'm sure. Next question we got, and it's kind of broad as it is short. What causes sugar?
Ooh, that's Pandora's box.
That's
right
Pandora's
there.
box.
But basically, there are two types of what we would call diabetes. I'm sure that's what they're talking about. And diabetes mellitus is the fancy word for it. And but basically, it comes down to type 1 and type 2. Type 1 is usually the type you're born with, okay? And it's just a genetic defect that people have. And then there's type 2 that kind of is acquired over as we get older. Type 1 typically requires insulin. And you treat type 1 and type 2 a little differently. And but some of your type 2s will eventually require insulin also because their pancreas just does not work as well. But most time for type 2, we can prevent a lot of type 2s. We've got a lot of new onset young children with type 2 diabetes because of sedentary or non-active lifestyles, poor diet, too much McDonald's, etc. No offense to McDonald's, my kids like it too, but
right.
You know, it's
too much of it.
You go back to the good book, moderation in everything is important, and but that's just a stereotypical location that we think about with fast food. But
well, this generation lives off of it.
Yeah, and unfortunately, it just doesn't have the nutrition and the value. It basically, the pancreas, which releases our natural insulin, it gets burned out because it's challenged so much throughout that early life. And, you know, like I tell my patients all the time, we're in this for the whole game of life, not just from one part of your life or a few weeks, but it's for the whole life cycle. And it's very important that we don't challenge too much of our body. You don't want to challenge your heart too much. You don't want to, you know, you want it to be fit, but you don't want to wear it out. And the pancreas is one of those organs of the body. It's important. So I think the original question, though, was how do you get it?
Yeah.
And like I say, so you could be born with it or you can acquire it over your life. Now, there are some theories or what we call hypotheses out there that a virus may cause it as you get older, and some of them they have called what they call a two-hit hypothesis. So maybe you've got the genetics that aren't real good to have, I don't know how you say, real positive for keeping a healthy pancreas. So you already got one hit that you're born with. Well, maybe you get a virus and that just puts you over the edge, and then you just can't take it anymore. There's different things like that. They've noticed some interesting correlations with different people throughout the world and different countries and different ethnic groups with that. But basically, from an American standpoint, the big diabetes that we deal with is the acquired type over time. and unfortunately we deal with it way too early in the young, and which could be very much preventable. But if we could get a hold on it, diabetes causes a bunch of other problems. Kidney problems, eye problems, heart problems, cholesterol. I mean, I could just go on and on. It just make your head spin. Makes mine spin sometimes because that patient gets diabetes. If you can't stay on top of that diabetes, you get ready. You're going to have some problems.
Yeah.
And so they may not die or succumb eventually to diabetes. Maybe something else that goes along with it. But if you have sugar, what we all call it, you better make sure that you are seeing your doctor on a regular basis and get to know them well and get them to know you well. And that way, so you have something different or about you that changes, it can be taken care of immediately, especially with your vision.
Yeah.
You know, your whole world changes if you can't see.
Yeah, you don't want to lose your eyes, that's for sure. Well, along those lines, that was a broad question. Got another one for you, and I know this is about as, well, you know, you can make this what you want to make it. What is lupus, and does it just strike the elderly? That was how the question was asked.
No, lupus does not just strike the elderly, and there is what we call like a generalized type of lupus, or one that affects the insides and the outside of the body, and then there's like a regular, a less severe type of lupus that you'll see just on the skin. That's pretty easily treatable, and we do that often in my clinic. But the internal type of lupus, it depends on what is all affected. Again, kidneys, different things like that can be affected, and with your primary care doctor and your endocrinologist, rheumatologist, those type of doctors, we can help take care of it. But if it goes internal, that's a serious disease, and it requires
surgery. Is surgery sometimes required?
The only thing
Or
I
is
can
it
think of
treatable
that
with
you may most
antibiotics,
time, not antibiotics generally, unless it's something that's a secondary to lupus. But there's a lot of medicines, and usually they're what we call like the trying to think of a basic term for it, but it's those type of medicines that help boost the immune system and to make it work right. Because lupus is almost like it's a failure in most instances of the body to recognize itself. So it sees like it's been around this kidney in your body, in your antibodies in your bloodstream all your life, and all of a sudden it's like it doesn't recognize that as part of your body anymore. So it looks at it as a foreign object. So just like it would a virus that's penetrated your body, it goes to attack it, and so it's a really hard problem. And then your immune system takes a big hit because it's instead of fighting foreign things, it's fighting local. You can look at it kind of like a country basis. You got too many internal problems in your country. You can't control the outside of your borders.
Yeah.
Well, we could get into that one.
Yeah.
But it's the same type scenario. Your body just is too focused on one thing and it can't focus on the other, and then you start getting sick from other things.
Let me give you a look, because we got about 4 minutes left. Let me give you an easy one, okay? Because those were two pretty broad ones. Can months make young men sterile or not? I've heard that all my life.
Yeah. I like a softball toward the end. I appreciate that. And but now they can.
They can?
Yes.
I didn't think they could.
You can have what is called cryptorchitis, okay? Fancy word, but basically the male organs down there, the testicles and whatnot, can get inflamed, and they get diseased or whatever, where will not make sperm, and you'll be sterile.
Good gracious! I didn't think it did.
Yes, it can.
That's pretty serious.
And so you don't want mumps, especially if you're still.
Well, you usually get them as a kid.
That's right. Still planning on having children,
If you get it when you're up in your 20s, I guess it's more serious then than it is when you were a kid, right?
Yeah, most of all those type diseases, the children tend to bounce back much better than we do when we get older. We get stuff like that, buddy, we're hurting.
Well, one more softball, because we got about 2 minutes left.
All
One
right,
more
that's
softball. They've had several people, and this has been kind of a universal thing at the beauty shop. They've had several people that took the flu shot and got sick. Now they're all saying they ain't ever going to take it again. And
that's
they're wanting to
always-
know why they got sick.
We had that
I
discussion
guess you have that, yeah. it's
in the
gonna
drill
be-
hall this weekend because we had people that had not had their flu shots and needed to get them. And in the Army, you ain't got no option. You're getting your flu shot.
They make you take
It's
the flu
just,
shot.
That's just the way it is. If you ain't got documentation that you've already had it for the year, you're going to get it.
Well,
And,
that's interesting.
Uncle Sam don't give you that option.
Yeah.
But the thing about, I'm gonna first tell y'all what the evidence and all that suggests when they study it. And that's that the flu shot has nothing to do with getting sick. There's no correlation of the flu shot causing the flu, okay?
All right.
Now, that being said, it takes in some people 30 to about 90 days, according to the literature I was reading, that says for you to build up your immune system, okay? So let's say if there's a flu epidemic out there right now, and I've not had my flu shot, I run to the doctor to go get it.
And you've been exposed to this current flu
Right, and I
epidemic.
come back, in the next week or so I'm exposed to it, right then, I can still get it because
Yeah.
I don't have the immunity yet
Right.
to fight it
Well,
off.
that makes sense.
So I think that's what happens. We get hit with the epidemic, everybody goes to get the flu shot. They
It's
ain't
too
had
late.
enough
They've
time.
already been exposed to the flu.
And that's why we start doing that, dude, in August and September, trying to get you ahead of that curve because we know when we get to around November, December, January,
It's
it's
getting a
on
little late.
as far as the
That's
flu.
right.
So that's the reason. And the older you are, or the more unhealthy you are, or have disease problems, it takes longer to develop that immune system response. So that, but I've had it myself, and I got sick too, and I still curse the flu shot, So, medical
Well,
people are not immune to
It
that.
works for a lot, just as many people that it don't. There's a lot more that it does. So,
Right.
I mean, we're hearing the bad side. There's the other side of the coin also.
Basically, that's right.
Any announcements from the hospital? I noticed they got up a billboard talking about all the new services they got.
Yeah, now we're going to start doing some colonoscopies and things actually in the hospital.
Don't
and,
have to go to Tupelo.
Hey,
then.
50th birthday, I hate to.
Yeah.
You get your AARP card and you.
Yeah.
And you get your colonoscopy, but that's a good thing that we've got going on, and we're just trying to figure out ways to serve the community. And if anybody can figure out there's something that we need to be doing, call my office, tell us, we'll look into it.
Make a suggestion. That's
Yes,
all
sir.
you got to do. Just like you can call 587-8176 and ask a question, and we'll get you an answer. We certainly appreciate your time this evening, Doc, and we certainly appreciate y'all's time for watching us. We'll be back next Thursday night at 6:30. Tune in. We'll try to get your questions answered. Hope you have a safe weekend and a prosperous week ahead. Good night. We'll see you.
Magnolia State Family Medicine, Health Center and Medical Spa, 1009B City Avenue North, Ripley, 587-8176. Call for your appointment. Providing modern medicine with Southern hospitality. That's Magnolia State Family Medicine, 100% veteran-owned and operated. Bethel University Physician Assistant Program affiliated. Magnolia State Family Medicine. Dr. Christopher J.M. Cummins, Medical Doctor. Fast, hot, and fresh. Open 24 hours just for you. Dodge's Store. Come be our guest. Dodge's Store, Ripley. We are 100% employee owned with friendly service and a fun atmosphere. High quality, low prices. We are Food Giant. Our deli serving breakfast, lunch, supper. Food Giant, 702 Highway 15 North, Ripley. Come shop Food Giant. Want fresh meat and fresh produce? Food Giant's the place. High quality, low prices. Food Giant. A proud sponsor of TV19 News and Sports. Cardinal Drive-In, 1807 City Avenue North, Ripley. Cardinal Drive-In, 837-2970.